Looking forward to hearing from you today. My first guest this morning, first guest of the week, is fighting an illness so rare that most doctors have never even come across it. You see people fundraising, don't you? And quite rightly so, for breast cancer or testicular cancer. But did you know you can get cancer of the eye, or ocular melanoma, to give it its correct terminology? It just looks like a freckle in the eye, but my first guest is Lucy from Blueberry, and she knows it's far more than just that. She's a mom, she's a wife, and back in 2012 she was diagnosed with this very rare disease. Today we're going to try to aid her plight and get better treatments for others. It's all about awareness, this, really. Hi, Lucy.
Hello.
Lovely of you to come in. Thank you very much indeed. It's nice to see you.
It's my pleasure.
I'm looking at your eyes now and they look as clear as a bell. I didn't exactly know what to expect when you came through the door, but your eyes are blemish-free.
Yes, the cancer that I have affects the back of the eye. So it's in the layer that goes underneath the white of the eye, but on the back of the eye, in the area called the choroid. It grows from, as you say, a freckle or a mole that's on the back of the eye. I knew I had a freckle on the back of the eye. I knew I had it there for about 7 years. I was being followed by the John Radcliffe, the eye hospital there. When it started to develop, when it started to change, I didn't know that eye cancer existed either. I knew I had this thing, but I didn't know it would ever change.
How did you know you had a freckle on the back of your eye?
Ironically, they were looking for another very rare condition that my mother had at the time, and so they were looking in the eye for signs of that, and they happened to come across this, what was referred to medically as a nevus at that time.
So it was by accident, really?
It was by accident, yes.
But it was a fortunate accident because they caught it very early. Absolutely.
So as soon as it started to change, as soon as it started to show signs of growth, they referred me straight to one of the 3 centres that treat this in the country. So there's only 3. There's one in London, one in Liverpool and one in Sheffield. So they immediately referred me there. I was treated at Moorfields in London with a treatment called brachytherapy, plaque brachytherapy, which is a form of radiation, where they sew a radioactive plaque onto the tumour. So they take the eye out of the socket, they put the radioactive plaque on there, they put it back in, and they leave it there for a period of time, anything up to sort of 5 or 6 days. Well, it penetrates the tumour, makes it radioactive, and then they go in again surgically and remove it.
Lucy, how did you feel when you were told you have cancer of the eye? How does that feel?
Scary. Because as you say, with breast cancer, people have heard of it. You go to your doctor, they know exactly the right pathway to follow. They say to you, okay, well, you can have your breast removed, or you can have treatment, you can have chemotherapy, you can have radiotherapy, and the chances are that 95% of the time you will be cured. With this, you go to the doctor and they say, oh, I've never heard of that before. So it becomes a situation where not only are you told you have cancer, which obviously is a very scary diagnosis in itself, but then you're also told, well, we don't really, you can go to one of these specialist cancer centres and obviously they will treat the actual eye cancer, but then there is no path to follow with regards to follow-up, scans, looking for spread. It spreads to the liver in 80% of the cases.
Does it?
And in 50% of people with ocular melanoma will obviously get spread, but in those 50% of cases it will go to the liver.
Sounds like a very aggressive form of cancer, is it?
It can be, yes. Yes, it can be. And it's treated at the moment like cutaneous melanoma as far as the treatments are concerned for metastatic spread.
How does it feel when you're about to undergo an operation which involves the removal of your eye from its socket, and so that the specialist, that is, can attack this thing?
It's scary. I mean, anybody will tell you that to lose any part of your eyesight is a very scary thing to undertake, because it's there all the time. You can't forget about it. It's there literally right in front of your eyes. So, and any thought that you might actually lose your eyesight, which could impact your job. I'm a statistician for the pharmaceutical industry, so I'm on a computer a lot. And the idea of actually losing, part of that eyesight and perhaps not being able to do your job in the way that you would normally do, perhaps not being able to drive as well as you would normally do, all of those things can be very scary.
So, Lucy, where are you today? Do you have it in the right eye or the left eye, this freckle?
It's in my right eye.
And can you see perfectly out of both eyes? You're wearing glasses today, I note.
I'm short-sighted, so that's why I wear the glasses. Yeah. But quite often I wear a patch over my eye. I've lost most of the central vision in my right eye, so I only get a little bit of peripheral vision. Everything's very blurry. And in effect, if you have one eye that's perfect and then one eye that's not, it's essentially you can get two images that don't converse with each other, so they don't really it's almost like you get an overlap. So everything I look at has an extra edge to it.
How does this thing affect you in your life? I've said before you're a wife and you're a mom too. Mm-hmm. How does it affect you? How does it affect your family?
I have had I'm very open with my children, but I have had the question of, Mummy, are you going to die? So obviously that's quite emotional and that can be quite hard, especially since I can't give them an answer. I can't tell them whether I'm in that 50%. And I can't tell them really what my risk of being in that 50% is going to be. So obviously that can be quite scary. Plus the fact that they help me with things. My depth perception is off, so sometimes they'll help me get downstairs, for example, and. So, they are intrinsically involved in it all of the time, my family. They're very supportive. I have a very supportive husband who helps me kind of get through emotionally and physically.
Why you?
It's a very good question. I'm not a sun worshipper. There has been some suggestion that perhaps there's a link between ocular melanoma and sun exposure. Especially sunbed use. I've never been anywhere near a sunbed in my life. I'm not a sun worshipper. I get bored lying on the beach for more than about 10 minutes at a time. I'm much more active. Obviously, we're doing the walk. It shows you just how much of an outdoors kind of person I am. So honestly, I can't answer that question. I mean, this disease only affects 6 in every million people. Which roughly translates to about between 450 and 500 people in the UK every year.
6 in a million, and you're one of them. That's why I asked the question, why you? And I guess you've asked the question, why me? Mm-hmm. Mm-hmm. A million times.
I try not to dwell on that. I think. I'm quite a positive person, and I think to move forward and deal with, what you have to deal with on a day-to-day basis, and do whatever you can to help, and that's what I feel I'm doing. I'm turning that why me attitude into well, okay, it has happened to me. There's nothing I can do to change that, but I can do whatever I can do to help. So I can work with charities like Ocular UK. To try and raise awareness, to try and gain funds. Obviously, that the charity mainly relies on personal donations. We are trying to, we offer, we put patient reps on trials that are coming up, for example. We also, the charity also has patient reps on guideline meetings. There's a move to try and get some national guidelines in place.
Yes, so that if other people have this condition, they won't be, I do excuse the pun and the expression, but so much in the dark, because you were given the diagnosis and they sort of knew about the treatment, but then it was just a case of, we don't really know where to go from there.
Yeah, it's very, we know, for example, that the best way of looking for metastatic spread, especially in the liver, is via MRI scan with contrast. At the moment, most GPs are going for an ultrasound scan. By the time it shows up on an ultrasound scan, it can quite often be too late to treat it effectively. So one of the moves is to try and make that a standard protocol, that everybody gets an MRI scan regardless of where they are in the country, or even in the UK for that matter.
You mentioned the walk. What you're actually doing is walking 87 miles. This is the Ridgeway Walk from Wiltshire to Oxfordshire. You might know it. And you're doing it in stages, aren't you? Every Sunday, is it?
That's right, yeah. So we started at the beginning of May. We finish at the end of June. We're currently at just over 50 miles. So we've got about 35 left to go. We crossed the halfway point, not Sunday just gone, but the Sunday before. That was at Streatley. And we're now up to... forgive me, I can't remember where we stopped yesterday. I'm that tired.
It all blends into one, doesn't it?
But with so we finish at Ivanhoe Beacon on, I think it's the last weekend in June.
Once again, to raise much needed funds and to raise awareness as well. Your ocular melanoma, you've just told me, I think I've got the statistics right, but you're a statistician, you'll tell me if I haven't.
That's right.
50% chance that it will spread, an 80% chance that it will spread to your liver.
50% chance that out of all of the people with ocular melanoma that it will spread to somewhere. And then for those that it does spread, so for those that are in that 50%,
Okay.
80% of the time it will go to the liver, sometimes it will go to the lungs. So that 20% will result in spread to some other organ.
But how do you cope with that? Isn't it a time bomb, really?
It's scary because, as I said, there are factors which make you more at risks. Like I said, mine was caught early, so I was lucky. But yes, there are people. I mean, that obviously you get to a point where I will have to have scans for the rest of my life. I will never get to that 5-year period where they say, okay, you're in remission. You can now drop off your scans.
You will never get the all clear.
Those scans will continue for life. I mean, people have been known to get metastatic spread up until, 20 years sometimes. It can live in the bloodstream for that long before it presents in an organ. So, I will never be clear of it. I'll never sort of be able to think, right, that's it. I'm done with this thing.
How often are your scans?
Every 6 months at the moment.
And then you're given the all clear as far as the spread's concerned, and you build up to the next 6 months. That's really difficult. That's really hard.
Yeah, there's probably 3 months that I feel like I can move on with my life. And then you're back down into the waiting for the scan, having the scan, then waiting for the results. And then, then you can relax again for another 3 months. I have known people who've got ocular melanoma who've actually said, they were actually relieved when they got the mets because it stopped that tension and stopped the worrying, and then they could actually act proactively with moving on with the treatment that they require.
Ocumel UK is the name of the charity that deals with ocular melanoma and the people that suffer with ocular melanoma. If we want to know more, I suspect they're on the website, aren't they?
There is a website, yeah, ocumel.uk, ocumeluk.com.
Yeah, I've got it. And it's OCUMEL UK, ocumeluk.com is the website.
Is it? Yeah.
Good luck with the work and
you.
good luck with the walk.
Thank you very much.
As well. I'm sure you'll complete that. It's been 87 miles. And in a way, increasing awareness and fundraising, is that your way of coping or helping you to cope?
Absolutely. I mean, that's the way of me being proactive in dealing with, how my mind copes psychologically with the unknowns associated with this disease.
Lucy, thank you for coming in today.
Thank you, Malcolm.
And thanks for talking to us about it. It's 24 minutes past 10 o'clock.